So, Dr. Gebbie, I'm Hugh Tilson still, in case I need to introduce myself after over 30 years of
Yes.
friendship. And I can't believe that we finally have captured you in a room. I mean, you're so busy and overall everywhere for this interview. Thanks for joining this series. This is Profiles in Public Health Leadership. Lord knows you qualify. You have the best profile I know. And a leader in every way I can think of. Kristine Gebbie, thank you so much for joining me at University of Kentucky Center for Excellence in Public Health Workforce interview, because we're going to focus on your work in public health workforce. I have an idea here. What if we created 10 essential services for public health, and one of them was to assure a competent public health and private medical workforce?
Good heavens, you want people competent to do the jobs they do?
And I want public health to assure they are. You betcha.
Yes.
And I know you do too, since you wrote it.
Well, I actually didn't write it. What's so funny?
It was one of the 10 essential services.
Yes, but
that came out of the public health work
right,
group of which
which
you
had
were.
been drafted before I became attached to that group as a staff person.
Yeah.
It's interesting, but I became a mouthpiece for it because it made such exquisite sense in giving us a foundation.
Right.
And reminding the public health people that you don't just worry about what schools of public health teach. Every day you're telling the physicians and nurses in your town what to watch out for, what to treat TB with, what kids to do. You are helping them be competent. And maybe you should expand on this in some way and really pushing, for example, local health departments to know every practitioner in their town.
Whoa.
And talk to them regularly.
And talk to them regularly and convene professional meetings and talk about professional concerns. And be sure that there's a system to ensure that they are properly credentialed.
Exactly.
Whether you're actually responsible for running it or not.
Yeah.
At least you have the obligation to your community to be sure it's in place.
Yeah.
A workforce issue. And I chose the pharmacy tracer just to make that point. And this includes an awful lot of people, like the dentists and the pharmacists, who often are left out of public health concerns when, of course, they're central to it.
They are central to it. We talked briefly about the AIDS epidemic. And
well, we're going to come back to AIDS right now.
Oh, okay. Oh, okay.
Right? Well, because you were recruited away from the state of Washington because of what you had been doing in HIV. So I want to talk about that and then what it meant to be the nation's first AIDS czar.
A wild ride.
We don't have a lot of time to talk about it, but again, apropos workforce, it was a huge insight builder into who does something about a national unpopular epidemic. So what were you doing in Washington that got you recruited?
Well, it actually started when I was in Oregon. Before I went up to Washington, I just happened to have the, I think, good fortune to get the HIV committee of ASTO, the state health director, started.
There you go.
Say, we got to have a committee. We got to talk about this. And we wrote 3 very nice monographs on what every state health department should think about HIV and what they should do. We were working with the ACLU and others nationally to craft those documents and get them out to the states. And then I was president of ASTO shortly thereafter, at the time when CDC was convening meetings about what to do, and ASTO was to be represented. So I was flying back and forth to Atlanta or to New York City to sit in on meetings representing the states. And I think there was a benefit that I did not come from California or New York, where the public health officials had gotten embroiled and locked into positions early on in our period of abject ignorance and could benefit from what they had done and not done, to think about other states with smaller workforces and less specialization and how we could incorporate that. So I became known as a public health official with something to say about HIV, and coming actually with experience in 2 states that were viewed as pretty progressive about HIV, that had not had huge riots and fights and problems. So that put me on the list. And some days I think I just got the job because I was the last idiot standing willing to tackle creating a new office in a White House that had just announced it was downsizing by 25%, with a staff that was borrowed from other federal agencies who really wanted my job in their own agency. To do what was called policy coordination, when I learned that coordination is an unnatural act committed by unconsenting adults. But part of what I was a face and a voice that could stand on the lawn of the White House and say, we care. We're starting to do something.
And have enough, and have the health credential so that you could say we care with the credibility of someone who understood this level of suffering.
Yeah. could go.
I mean, some bureaucrat
no.
could say we care,
Sure,
and you'd say, yeah, thanks.
No, but I could go on rounds, as I did, I'm thinking of one particular
Walker
hospital this was
yeah.
in the Southwest United States, an inpatient unit, and noticed that the group making rounds was starting to talk over the patient, and with no hesitation, drawing on my own clinical background, walk up to that patient and say, hi,
Mr. Smith, yeah.
how you doing today? And
Yeah.
break the tension in a way that I suspect a non-clinician could never have done.
Right.
And I could sit and talk with physicians and nurses about my own caregiving experiences and what we'd seen.
Right.
That really helped, I think.
And I promise we'll talk about workforce, because here's one of the competencies. I mean, you said earlier public health jobs are fungible, and one person, any person, but there are some roles where being a clinically trained, competent person makes all the difference.
Yes.
And this was one, where we really wanted an AIDS czar who would be able to touch a person. Well, you can't do that if you're just a Republican or whatever you are.
Or whatever you were.
Or whatever you are.
Yeah.
But you can if
Right.
you have transcended that body politic.
Yeah. Well, it's part of what I said when I think of assembling a public health workforce. If you plopped me on Mars and said, create a public health workforce, I'm not sure what jobs I would assign them, but I would want somebody who thinks like a doctor, diagnostically, intervention-oriented. Somebody who thinks like a nurse. What does this disease mean to you, and how can we help you through it?
And
Somebody
is
who
willing to
thinks,
touch the person and say, how are you doing today?
Somebody who thinks like a sanitarian.
Oh, yeah.
How do we regulate this system to tidy it up? Somebody who thinks like a health educator. How do we translate this? Somebody who thinks like a statistician. Hey, how do you count stuff? An epidemiologist on the one hand, on the other hand. However we put all
That's
those
why I'm wearing
together.
my apples and oranges
I like
tie. I
that.
don't know if you noticed, right? It's the epidemiologist tie. They can never figure it out.
I know. Someday we're going to find a three-handed epidemiologist, and it's going to really drive us nuts. But I want those worldviews around my table.
Yes.
And I might think of sending them out to do different jobs on a day-to-day basis.
Right.
But it is the collection of those worldviews that makes public health work and work well.
Now, on a different taping, we'll talk about that experience, because although it was fairly short as AIDS czar, it probably fills hours of conversation. You and I have had those hours in front of an audience, in fact, at one point in our lives when we talked about major life-altering career decisions.
Yes, I remember that.
How long were you AIDS czar?
I was officially AIDS czar for 12 months, 1 year.
12 months. And many of us were devastated that it ended. Were you among those who were devastated that it ended?
I think a piece of me was relieved because it was becoming clear what I had bitten off and how unprepared I was for parts of it, because I had never apprenticed in Washington, D.C. So I didn't quite understand that. But it's hard to move on and say, I was only here a year and I didn't solve the problem, and there's so much to do, and I should have been able to perfect everything, and what's wrong with me?
Yeah. So you're going to, in very short order, for the people who are watching this, draw a public health career conclusion on the basis of what happened to you after 1 year.
You have to pick yourself up and go on.
Bingo. And so one of the attributes of a leader is never to be locked into a single set of solutions, because they can disappear in a heartbeat.
And I made a very clear decision, personally. I think if I had been the sort inclined to do so, that I could have called up a speech agency, sent them my CV, said I'm willing to talk about what's wrong at the White House or what's wrong with AIDS in this country.
And that was even before the days of Fox News and MSNBC.
And gone on the circuit. And other
you
people,
could have made a fortune
other people who came
dishing
and
the
went
dirt.
from that administration dished the dirt. I chose not
No,
to,
you didn't.
because it wouldn't have done anybody any good.